So Neil, I went on to it, like you asked, took a look at it, and just some points. From a mobile perspective, I think the majority of us now are mobile users. You really can't, it actually doesn't pop up. Like it's not mobile friendly at all. So it's feedback to you. But what I draw from it is when you look at the percentages in terms of by racial demographic, the way you guys presented it, there's a large bar for white and then exceptionally small bars for both Hispanic and African American and all the others, comparable to what I believe Dr. Fine was saying in his testimony. And I went back and I also looked at the percentages for different municipalities. And I see that, one of the municipalities I represent is around 58, less than 60%. Very comparable to, say, Newport. And then you get Tiverton, Little Compton. It's funny, and some of the more urban areas are higher than those. And one of the reasons why I've been so vocal on this issue in terms of the vaccine mandates, stuff like that, because I know within my district that regardless of hesitancy or non-hesitancy, mandates or non-mandates, I know that the residents of my district are going to be disproportionately impacted by these mandates just based on the numbers. So again, because of that, it's one of the reasons why I've been so vocal on these things. And how do we not look at this and see that these mandates aren't only going to have a disproportional impact on just Burrillville or just Tiverton, but even on these areas in which we tried so hard to avoid? I mean, our first round was specifically targeting specific racial demographics. And just based on what I'm seeing, it shows that we failed at that. But now we're going to mandate it. So folks are going to lose their jobs. It's folks from my district and then folks from Central Falls, Providence, Newport. They're going to lose their jobs over this. And I understand that there's public health concerns, but the desperate impacts on certain communities is just blatant to me. And I just haven't heard anybody talk about that yet. So I don't know if someone wants to touch on that. Neil, I know you're just the data guy. You're not necessarily the policy guy. But Dr. Fine, if you want to touch on that, I'd welcome your comments.
Dr. Fine, please. Neil, speak to that first.
Sure,
and then
sure.
Dr. Fine.
Thank you, and I thank you for the compliment that I'm a data guy. I am not a data guy at all. I have a great team of data people behind me. I'm just a public relations guy that's happy to help out. But to your point about targeting the disproportionate effects that we saw early on in the pandemic, that was a really big focus for us, to focus on where we saw a very disparate population of hospitalizations, deaths, related to COVID. That's why we started with our limited supply in those areas. Going out further, completely agree with you. We need to do more to make access to the vaccine more accessible in all the communities that you're seeing that you mentioned, Little Compton, Foster, Gloucester, because ease of access is also going, once you get somebody over the hump of vaccine hesitancy, making it easily accessible, continuing to make access free is going to be just as important. So there's kind of a twofold battle we have there. We're focused really hard on both of them, and would be happy to partner with you on anything you think would be beneficial to reach those in Burrillville.